And I think I understand your question, which seems to boil down to why and how would an attorney benefit from my services? So off the top of my head, there are 3 service dimensions that come to mind that my existing clients have found out about me and that perhaps other attorneys might like to know. Now, these service dimensions are regulatory expertise, lower cost, because cost does matter in this process, and professional caliber reports and testimony. So let's begin with the regulatory expertise dimension first. Naturally, after 30 years, you and they should expect that I have a deep understanding of all Joint Commission CMS regs. I understand that these regulations can be applied as either standards of care to substantiate the patient's claims of negligence, or conversely, these same healthcare regulations can also be referenced to help the defending facility to refute the plaintiff's claims. So in other words, to help demonstrate that the care in question was compliant with regulatory expectations and therefore less likely to have been at the root of any harm or injury that was caused. So another way to explain this is I'll break it down into sort of 2 camps. First, we begin with the plaintiff. In the simplest terms, what I have found is that the plaintiff's claims usually center on the hospital either not doing something incompletely, or just blatantly wrong. Either way, in either instance, it does seem to break down to non-performance. Okay? So my duty for the plaintiff in that scenario is to cross-evaluate all the claims of either non or incorrect performance against the specific regulations. I will then note any examples of performance that were in fact below regulatory requirements, confirming that the care was delivered below the standard of care. Now, that's the same process that I use for other types of cases that I've worked on that may be related to governance matters or management negligence, or the many aspects that can occur when there's contractual relationships on the periphery of a patient becoming injured or harmed. So that's sort of for the plaintiff side. Now, conversely, for the defendant, their goal, it appears to me, is to factually prove that the plaintiff's claims of non-performance are unfounded, to sort of dismiss them. So my role is to help support that effort, honestly, of course. I will examine and note all examples of performance that actually met or exceeded the regulatory expectations. So in that way, I can help the defendant to demonstrate that the defending hospital's practices or the performances were not negligent as related to regulatory standards of care. So that sort of summarizes the regulatory expertise part of it. Now, the second dimension I mentioned to you in terms of service is lower cost. Now, I've been a business owner for 22 years, as I mentioned earlier to you, so naturally I assess the competition. It's only reasonable. I have found in my assessment that there's only one healthcare expert in my arena with over 30 years experience like myself. He seems to be a bright and a busy fellow, from what I've read. But the first real distinction that's worth bringing up is that my hourly service is 60% of his service rate. So that is to say that my work efforts cost 40% less than his. Now, on top of which, it's fair to add that he, unlike me, has never been a hands-on patient care provider. And that's a point that I think is important, because myself and many who have been patient care providers, we seem to feel that you can never fully understand the complexities of patient care, the interrelated nature of communication, documentation, etc., unless you were once responsible for the care of a patient. Maybe it's biased, but so be it. Now, a second point worth mentioning in terms of distinction is that he, unlike me, has not published 1,500 healthcare policies and have them enforced many throughout the organizations throughout many parts of the country. He's not made over 500 visits to our nation's hospitals assessing, approving, or training executives or clinical leaders or management folks on the principles and practices of Joint Commission and CMS, as have I, for virtually over 20 years. So in terms of cost, listen, let's not kid each other. Cost matters to my clients, and cost matters to those individuals and companies that hire my clients. So in terms of expert fees, my service rate is 40% less than the next best thing. So there, it had to be said. Now, this brings us to the third dimension service that I mentioned to you, and that is effective reports and testimony. So there's many pieces that sort of come together as part of that, and I would say that the top three overlapping challenges to meet in order to deliver good reports and effective testimony is, first off, is I feel to be very fluent in my ability to assemble all of these overlapping fact streams, break them apart, reassemble them, reconstruct them so that they read and sound simple. Okay, so the short version of this is I have to make the complex simple. Now, secondly, on top of which is once logical simplicity is achieved, it's my responsibility and duty to write irrefutable opinion reports, which is often accomplished by my ability to anchor my opinions with the actual regulatory requirements. And lastly, I've been told that my depositions and trial testimony have been conducted in both a poised and authoritative manner, as my client should expect. Now, I understand that this is all in the eye of the beholder, but it is worthy to say that I actually do enjoy the preparation and the testifying process.